Are there any types of patients dealing with different diagnoses and conditions that should avoid a V-cell therapy?
I don't think so.
Hmm.
And that's a conversation. The biggest conversation around that is cancer.
Yeah, big C word.
And yeah, the big C word. And this is a whole nother podcast, but I think there's a lot
Yeah.
of and there's a lot of different theories of what truly causes cancer and what cancer is. And if we don't know quite what that is, if it's not as clear cut as like I was trained and retrained, it then goes, well, how do we treat something if we don't really? I still think that there's a broader conversation of what cancer is.
Hmm.
So if we are afraid that if we are giving regenerative modalities to the body, that we're also getting regenerative things to cancer.
Yeah.
Meaning if I provide something that's going to improve something in your body, is it also going to make cancer worse? I'm of the thought that no, if I think cancer is a imbalance for whatever that imbalance may be, and that's another uh, rabbit hole.
Yeah.
But I feel if you're strengthening your immune system and your cellular capacity, it has the resilience to deal with that imbalance, which we will call cancer. And there are some places that actually use stem cells of different modalities for cancer therapies.
Hmm.
There's, and so it's a conversation with the patient and the patient's oncologist or whoever. Um, but in general, I don't think there's any condition or individual or something that would either be restricted from it or wouldn't benefit from it.
Well, the beauty of it is you're utilizing something that's already in the body.
Yeah.
You're not introducing anything new.
Mhm.
You're not trying to, get a kind of biochemical reaction by adding chemicals or anything like that. So it is one of the most natural forms of therapy you could think of. This is just activating our innate healing abilities.
Innate
And
intelligence.
that's why I believe it's not really looked at in a way, let's say, as stem cells are, especially by the FDA and medical boards. You're not adding anything new to the body. You're just taking it out, just using it and putting it back in.
Yep.
So
Yep. And beautifully said, because that's one reason why the FDA, it is so safe. And we are, I love that you commented on that because that's what I feel. I feel it's a very sanctuous, energetically aligned. We're just tapping into your own intelligence, maybe giving it a little boost to say, hey, this whole area over here needs some of your love, needs some of your information, needs some of your it's been bombarded a little bit or it's been misguided. Maybe you can come put it back on board. Uh and that's it. And the other modalities are really just to support what our bodies are naturally able to do when we get out of the way. And
yeah.
this another we're just coaxing it or encouraging it to do what it's naturally meant to do. And that's why I got behind it, and I keep using it because it can't hurt at all uh,
Hmm.
as far as causing any reaction or damage. And yeah, so.